For Port Coquitlam.
Thank you, Madam Speaker. And before I begin discussing Bill C-30, Madam Speaker, we must stop to recognize that Indigenous women and girls continue to be violated and marginalized at rates much higher than those in the general population. Today is the National Day of Action for Missing and Murdered Indigenous Women and Girls, and New Democrats add their voice to the collective call to bring an end to the injustices suffered by Canada's Indigenous women and girls. I raise my hands to the members from Winnipeg Centre and Nunavut who continue to advocate and bring understanding to this House of the cause of the systemic abuses that Indigenous women and girls continue to experience, and to hold this Liberal government accountable for their lack of action. Madam Speaker, Bill C-30 is here at a very critical time for Canadians. There are too many struggling with the rising cost of living and the challenge of keeping rents paid and food in the fridge. Yet the fact that we are here in need of immediate financial support for millions of Canadians is not an accident. It is a result of bad Liberal and Conservative policies. Successive Liberal and Conservative governments have prioritized tax breaks and subsidies for the wealthiest in this country, while intentionally eroding the social safety nets that support the well-being of the majority of Canadians. Poverty and homelessness is growing in this country, and it is a reality in every city and every town. While fossil fuel companies and big corporate grocery chains are bringing in billions of dollars in profits, people are falling further and further behind. It is far past the time where the Liberal government needs to close the long-standing tax loopholes for the super wealthy and finally make large corporations and the largest polluters pay their fair share. It is no secret that corporate greed is hurting Canadians, and it has only increased and magnified like so many other things during this pandemic. And while the Liberals and the Conservatives protect the profits of the wealthiest corporations, persons with disabilities, single moms, seniors, and families on fixed and low incomes are not able to afford to purchase fresh fruit, cheese, meat, and some of the moms that I've spoken to in Port Coquitlam are limiting their meals to one a day so that they can afford to feed their kids. You see, Madam Speaker, after too many years of consecutive Liberal and Conservative governments making decisions to put corporations above everyday people, our social safety net is eroded. The social safety net that supports the well-being of Canadians has been eroded to the point that we are here today trying to put patches of immediate support in place. New Democrats are here to act on this immediate need, and we are using our power to get this government to get financial support out to people with Bill C-30 and Bill C-31. I include Bill C-31 here because the two bills are connected. They're both offering immediate investments in the well-being of people, investments that never would have come from this government without the pressures of the New Democrat. And New Democrats will not stop fighting for people, even after these immediate benefits kick in. We will continue to force this government to do the right thing and put people first. We will continue to stop fossil fuel subsidies from going to the largest polluters, close the tax loopholes for the wealthiest, and stop exploitation of workers, and get our healthcare system back on track. The healthcare system is broken, Mr. Speaker. We see it in our communities every day, and a broken healthcare system is hurting people. Nurses have worked tirelessly, doctors, hospital staff, to the extent that they are burnt out, and people who are sick are not getting access to the care they need. We've all heard the heartbreaking stories in our communities of those that have gone to the hospital for help and have not been able to make it in time, or have decided not to go at all, Mr. Speaker, with fatal consequences. This government must invest in care workers immediately and increase those health care transfers the provinces have been calling for. 1 in 5 people in this country works in the care economy. And those professionals and personal care workers, nurses, doctors have been exploited. And that exploitation comes from discrimination. Gender discrimination has kept wages low in nursing. Nursing, teachers, childcare workers are all disproportionately women. And this government has not invested in their wages or their pensions, expecting them to carry the burden of an overloaded and underfunded economy and underfunded systems. The care economy is underpinned by exploitation of immigrants as well. More often they are women without secured status. This is unacceptable. Immigrants deserve better. They deserve investment and support. New Democrats will continue to force this government to respect the workers in the care economy by paying them properly and give immigrant care workers immediate permanent status and give long-term care workers the protection they deserve with legislation. We need workers in this country. Labor shortages are in every industry. There is a real problem that this is a real problem that this government has not brought any solutions to yet. When we think about labor force, we know that unaffordable housing is exacerbating this problem. Workers cannot afford to live where they work. It was the Conservatives under the Mulroney government and then the Liberals under Chrétien who axed housing programs in this country. In fact, the Liberals outright cancelled the National Affordable Housing Program in 1993, almost 30 years ago. That is why we have a housing crisis before us. Now, Bill C-31 has a $500 housing subsidy that is coming for renters. This is a small gesture, a good gesture. This housing benefit is a one-time $500 payment to Canadians who qualify. Specifically, it will help families who earn a net income of less than $35,000 a year. Mr. Speaker, there are many, many people in Canada that earn less than $35,000 a year in this environment. That's 1.8 million Canadians. This housing benefit, this renter's benefit, will make a real difference at this critical time. But, Mr. Speaker, financialization of housing needs to be addressed immediately. It is contributing to unaffordability. The Conservatives will say that they are there for people on housing, but they do not talk about the need for affordable housing, the right kind of housing. This is not just a supply issue. 1 in 5 Canadians are paying more than 30% of their total income for their housing, and that is not sustainable. At the same time, for every new unit of affordable rental housing, 15 units are being lost. 15 units for every new one. And we wonder why we are seeing homelessness on our streets. This is affecting the most marginalized people in the country, pushing them every day to the brink of a tent pitched in a street. As the NDP disability critic, I hear from the disability community of the realities of not being able to make ends meet with skyrocketing housing costs and the threat of displacement every day. Food costs, too, becoming unmanageable. As they wait for movement on the Canada Disability Benefit, they are falling farther and farther behind. Bill C-22 needs to come back to this House immediately so that the long-term support that persons living with disabilities deserve, should be legislated, can be passed in this House. Almost 1 million persons with disabilities are living in poverty. It's a disgrace, Mr. Speaker. And it will only take the will of the Liberals and the Conservatives who could have supported a motion from my member across the way from Kitchener for an unanimous consent last week. New Democrats are ready to fast-track this benefit. Back to the cost of food. In my riding of Port Moody Coquitlam, a disproportionate amount of food bank and food rescue recipients are persons with disabilities. And more children are food insecure. Children are food insecure. Too many schools are having to feed our community's children. In a country full of natural resources, with a new bursting aspiration to make batteries for electric vehicles, yet we're not investing in food. If it was not for the not-for-profit sector, even more Canadians would be hungry right now. Failed policies on giving to the rich while taking away the social safety nets, like affordable housing, is hurting people in this country. A beacon of the Canadian social safety net is our health care plan. Our health care, Mr. Speaker. And thanks to the New Democrats, that finally includes a historical dental care plan, which is a profound and long-lasting benefit for millions of Canadians and will be transformational for generations to come. You've heard it many times while discussing Bill C-31 that the #1 surgery for kids in hospitals is tooth decay. How is that possible in Canada, that there's kids that need to go to the hospital to be put to sleep to deal with their dental care? Mr. Speaker, with the heavy lifting of the New Democrats, the Liberals have finally taken the first steps to true universal health care by adding the long-awaited dental care. It should not have taken this long, and New Democrats will hold this government to account for a full rollout to every Canadian that needs it. And I'll take a moment here, Mr. Speaker, to speak about persons with disabilities and their dental care. There was a woman in my riding that she was on disability benefits and she had coverage for dental care. But the clinic that she was going to was charging $20 for the visit. And she could not go for her second visit, Mr. Speaker, because she didn't have the $20. Just not acceptable that this is the situation we're putting too many Canadians in. 35% of Canadians lack proper dental insurance, and that number jumps to 50% when we talk about low-income Canadians. 7 million Canadians avoid going to the dentist because of costs. It's shameful. It's something that has to change. Canada's most vulnerable face the highest rates of dental decay and disease and the worst dental care. New Democrats are going to change that. New Democrats will not give up until all Canadians have access to the dental care they need. This is health care, and we need to start with kids. Lastly, when it comes back to getting immediate support to Canadians, the New Democrats led the way on Bill C-30, doubling the GST credit. This rebate should have come a lot sooner. In fact, it's been over 6 months that the NDP have been calling on the government to double the GST credit. We have relentlessly pushed for this, and now we know that 11 million Canadians who need it the most will get some financial relief. Likely before the end of this year, people in my riding of Port Moody Coquitlam, Mr. Speaker, are asking me, when can I get it? They are desperately in need of any kind of financial support in these times. With much pressure on the Liberal government from the NDP and with no help from the Conservatives. No help, Mr. Speaker. In fact, it's because of the Conservatives and the Liberal government successively that we're in this problem, where we don't have social safety nets that can keep people in homes and keep food in the fridge and to keep people healthy in this country. With much pressure on the Liberal government from the NDP and with no help, again, from the Conservatives, this House is in a position where we can immediately make lives just a tiny bit better for people, providing these very small income supports immediately. New Democrats will always put people first, but we need to really, this Liberal government really needs to start making real investments in people and their well-being in Canada.